US study recently found that loneliness can increase the risk of death by almost 10%. Loneliness increases the risk of heart disease and puts people at greater risk of blood clots. Loneliness is estimated to be as bad for people's health as smoking 15 cigarettes a day. A 2006 study of 3,000 nurses with breast cancer found women without close friends were 4 times more likely to die than women with 10 or more friends. Around 10% of over 65s say they are lonely or very lonely, and another 20% are occasionally lonely. The risk of dementia almost doubles in older people who are lonely. Befriending is regarded as especially valuable for those living alone, where family support was unavailable, and for the recently bereaved, as well as for the carers of older and frail people. Kincardine and Deeside Befriending Service Project reported increased confidence in going home from hospital in 100% of their service users. There was a 14% reduction in bed days lost to delayed discharge against the same period the previous year. The team manager for Older People and Physical Disability Services, Aberdeenshire Council, said the befriending service has improved the confidence of clients who can be reluctant to leave hospital by providing practical and emotional support. Volunteering must be placed at the centre of policy planning and delivery. Volunteering should be supported by developing and implementing more effective policies. Volunteering does not just happen, it needs to be supported and resourced. Loneliness is an unpleasant and distressing emotion experienced due to the lack of companionship or as a result of social isolation. Loneliness is a very real and damaging feeling suffered by people of all ages. Anyone of any age can suffer the effects of loneliness and isolation. People in these following groups may feel particularly vulnerable: students, new mums and dads, single or divorced people, people working from home, retired people, carers, people with career-focused lives, people from minority groups, socially excluded people, those who are bereaved, those with a disability, those with a disease. Almost anyone. Higher levels of loneliness can be associated with living alone, infrequent contact with family and friends, physical and mental health symptoms, chronic work or social stress, marital or family conflict, poor quality social relationships, old age. The effects of loneliness include adverse feelings, separateness, alienation, distress, and isolation, poor mental and physical health, adverse physical and mental outcomes, increased anxiety and social withdrawal, increased unease, dissatisfaction with life, increased levels of depression, poor sleep quality, increased risk of high blood pressure, cognitive decline, dementia, and susceptibility to viruses, higher quantity of medications and A&E use, declined quality of life, feelings of self-harm and/or suicide. Ten 10% of the population aged 65 or over are often or always lonely. Half of all older people, over 5 million, say their television is their main company. 17% of older people are in contact with friends, family and neighbours less than once a week. 18 to 34-year-olds are more likely to feel lonely than the over 55s. Loneliness poses an equivalent risk for early death as smoking 15 cigarettes a day. Loneliness is linked to the development of depression, poor recovery from illness, psychological distress, and suicidal behaviors. Preventing and alleviating loneliness helps older people to remain more independent. 76% of GPs report 1 to 5 patients a day come into their surgery because they are lonely. Traditional face-to-face befriending allows for the development of an ordinary, warm, reliable relationship with another person who is lonely and may have other life problems. Face-to-face befriending usually takes the form of a weekly visit from the befriender to the befriendee's home, or enjoying coffee, lunch, or other activities out. Telephone befriending is for people who may just prefer to chat on the phone, someone who may be waiting for a while before they're matched with a suitable befriender, or it can also be used as an add-on for a befriendee who's feeling particularly vulnerable and may benefit from the extra contact. It helps in reaching out to more people with transport or other restrictions. Group befriending allows for people to meet together in activity groups with the outcome focused on positive social interaction with more than just one person. This is a valuable service for befriendees, as many of them can attend the groups with their befriender who is there to support them. It allows people to participate in activities in a very informal manner towards achieving the aim of reducing feelings of loneliness and isolation. Befriending skills include a cheerful and friendly personality. Engagement skills, the ability to build relationships with people based on trust and mutual respect. Communication and listening skill, a non-judgmental approach. Empathy skills, the ability to understand what it might be like to experience what the other person does. Patience and tolerance. Understanding of the nature of confidentiality in a relationship in order to build trust. Sensitivity to the individual needs of others. Understanding of the concept of respect for dignity and to practice it accordingly.